Today, this is Dr. Hana Solomon. She is helping us focus on health today with a procedure called nasal washing. Good morning, Doctor.
Good morning.
Solomon, good to see you.
Thank you for having us,
You
Fred.
brought along Kirsten Bellman, who's going to be one of our patients today. I have a deviated septum. She does not, so we're going to see two examples there.
Great.
Tell me about nasal washing and exactly what it is and how you came up with it.
Nasal washing actually has been performed by Buddhist monks for centuries and centuries. As a pediatrician for 20 years, I found so many patients who had nose problems and ear problems and sinus problems and even asthma, and not wanting to give drugs out all the time and wanting to prevent those illnesses rather than treating them. I began to develop this nasal wash bottle, and with the help of my patients and their feedback for 20 years, I perfected this system. This system actually delivers the flow along the nasal floor, removes about 80% of the irritants out of the nasal cavity, and draws from the sinus cavity out and exits the opposite nostril.
Okay. Kirsten, we're going to let her do it, and you describe what she's doing here. You said it's fairly simple. It's not just for adults. It works for kids, too, and it's not just for kids. It works for adults.
Absolutely, and it will reduce the amount of medications you use for allergies if used on a regular basis. Actually, she is going to hold the bottle straight up and have a neutral neck, so she doesn't have to bend or twist in the shower, and she's going to block the back of her throat by just making a K sound, similar to what you do at the dentist when they're cleaning your teeth, and she makes a complete seal with the bottle, and it will exit out the opposite nostril, and with it comes most of the goop that's in there. And actually what this does is it actually helps you, besides removing the allergens, pollution, irritants, it actually helps you breathe better. It shrinks membranes. It allows you to smell. Appreciate smells, and it helps your breath.
Well, you also said it reduces the amount of money you spend on over-the-counter medications.
That's a whole other subject.
That's a whole other subject on it.
$3.2 billion is spent on diagnosis and treatment for nose issues.
Okay, I'm going to try it as we go to break.
We're going to get you your own bottle.
Okay, you can get Nasopure in Hy-Vee stores in Kansas City, Lee Summit, and Independence, and at Nature's Market. Check out the website for a link to more Nasopure information.
I want to introduce you to Dr. Hana Solomon. Good to have you here.
Thank you
were on earlier this year in the spring, I guess it was, in March or April. And we talked about a product that you had developed, which is called what?
Nasopure.
Nasopure. And it does what?
It rinses out debris, allergens, whatever you happen to have in your nose. It will help rinse those irritants out.
So what you're saying, what we were talking about back then, if you have hay fever or you have allergy, you can take this stuff and it's going to rinse out your nasal cavity, and you're going to feel a lot better. Is it going to get rid of the allergy problem that you have?
There's a study that shows that rinsing after exposure to anything, allergens, pollution, anything, you will rinse out 80% of what's in there. So if you're exposed to some virus, if you rinse immediately, there's a good chance it will rinse the virus away before it has a chance to adhere.
What about the common cold?
There's some long-term studies that look at people who rinse on a daily basis, whether they're symptomatic or not, every day, they will ultimately have less colds than the folks that don't rinse.
Because you're getting the germs, getting the germs out of there
before it has a chance to adhere to the mucosal lining.
Now, this product is really very simple. What are the ingredients?
Sodium chloride and sodium bicarbonate.
There's salt.
Salt.
And it's in water.
Plain tap water.
Now, what's keeping people from just taking salt, mixing it, and squirting it up your nose?
Actually, that's what we've done for 20, 30, or 40 years, is doctors would often give the recipe to patients. What I found in my practice is that most patients would say, thank you very much, but where's my drug? Where's the prescription? So a few years ago, I decided to test this, and I made little Ziploc packets, and then when I had a patient who would benefit from it, I would say, here's the free recipe, here's a packet of salt, do you want to try it? And the folks that would try it would not come back as often, which is a sign of my success.
Right. So you gave it to them free, then you decided, well, I'm going to just go ahead and I'm going to put this on the market and see what happens. It's available. It's available at D&H Drugs. It's available locally here. Right?
At almost all the pharmacies.
It's called Nasopure. Now, little Sophie out here, what's your last name, sweetie?
Sophie.
What?
Murphy.
Sophie Murphy. What a pretty young lady you are. Thank you for coming. Now, you can do this, okay? Now, it's you know, if you're having breakfast or you're having lunch right now, don't worry about you. Just look away. But actually, there's nothing bad about it at all.
No, not at all. This morning, Sophie's dad told me she woke up and said she couldn't sneeze.
She couldn't sneeze?
Yeah.
Is that what happened?
Yeah.
You couldn't
And then
sneeze?
what happened?
She blew her nose.
Couldn't blow my nose, so she asked Daddy to fix up a bottle for her.
Uh-huh. Oh,
Of
Sophie,
Nasopure.
You really like this, huh? Okay,
Yeah.
go ahead. Let's see what you do there, Sophie.
Can you show everybody?
Okay, okay.
Let's do it this way.
Huh?
There you go.
Oh, okay. Oh, very nice there, Sophie. Okay, Sophie. That's nice. Are you okay?
How does that feel?
Good.
Yeah. And if you got a bunch of gunk in there, it just washes it all out, doesn't it?
It's very simple.
Okay. You want more information? Thank you, Sophie. You were wonderful. Thank you. Okay, you can look back again now if you're having breakfast. It's all right. For more information, what can they do, Doctor?
They could call 999-0450
Or go to the website.
or go to the website.
Yeah, and I know it is available at D&H Drugs. Isn't it?
Yes.
Okay. All right. You check it out on the web. You can pick it up locally, and hopefully it'll be sold regionally and nationally. Best of luck to you, and thanks for sharing that with us.
Thank you so much.
All right. We'll take a break. We'll be right back. Stay with us.
Good.